so if you have a tender and swollen bump on your eyelid, then there's a chance that you could have what is called an eyelid stye. These are often unsightly, they can be irritating, and they always seem to show up at the worst possible time, like right before a job interview, a wedding, or some other social event. But how do you get rid of a stye? Like, what are the treatment options, and when should you see a doctor for it? That's what we'll be covering in today's video. But first, what is a stye? A stye is a common term to describe an infection of one of the glands of the eyelid. It usually appears as a red swollen bump, it's usually a little tender, and it can even form to a head, kind of looking like a pimple, like it could drain pus. But it just happens to be right in the edge of the eyelid. The medical term for an eyelid stye is called a hordeolum. If the infection affects either the sweat glands or the eyelash follicle on the outside of the eyelid, then we call that an external hordeolum. But sometimes the infection can affect one of the oil glands called the meibomian glands, which are a bit deeper in the eyelid, and instead we call that an internal hordeolum. But these types of infections are actually really easy to get because most of it's caused by Staph aureus, the bacteria that commonly lives on our skin. So all it takes is for you to rub your eyelid, maybe put in contact lenses, or even put on makeup or other products on the eyes. However, a stye or a hordeolum is sometimes also confused with another bump on the eyelid called a chalazion. A chalazion is more of a hard nodule that appears on the lid that is not tender or sensitive, and we actually went more deep into chalazions and the treatments for that in another video, so if you want to learn more about that specifically, I'll put a link to that video in the description. Alright, so how do you treat a stye? Well, let's first start talking about conservative or more at-home therapies. Probably the most frequent therapy or treatment you'll ever hear of is that of doing warm compresses. The whole point of this is to draw heat to the eyelid that will dilate the blood vessels, drawing blood and immune cells to that area and clear the stye. It also helps melt any thickened oils in the oil glands as well. The only one heads up I like to give people is that because you are applying heat to the eyelid, it may make the eyelid look more swollen and appear like it's getting worse before it starts getting better. Also, doctors sometimes give a heads up to patients with rosacea, as the skin condition rosacea can be triggered by heat, so in those cases, doctors usually recommend to just get the heat to the eyelid and not get it onto the face. The easiest way to do a warm compress is actually to get a warm compress mask. You put these into the microwave for somewhere between 20 and 30 seconds, and then you put that on the eyelids for 5 to 15 minutes, and you can do this up to 3 to 4 times a day. There's actually many different brands of these types of warm compress masks. You can usually find them at your local eye doctor's office, but if you do want to save a few bucks, I'll include some discount codes and links in the description below to some of my favorites. Another part of the at-home treatments is in fact doing eyelid scrubs. This is because a lot of styes are in fact caused by buildup of dead skin cells and microorganisms that often live on the edge of our eyelids. Doing eyelid scrubs helps reduce the risk of getting future styes, but also helps reduce inflammation and risk for dry eye symptoms. Usually doctors recommend that cleaning the eyelids twice a day while somebody has a stye on the eyelids, but then usually at least once a day, just as kind of a maintenance dose to help reduce, again, future issues with dry eye and inflammation. There are both eyelid cleaning foams as well as eyelid cleaning wipes that you can do eyelid scrubs with. I personally like using the wipes just because I find them more convenient. To do it, you simply just have to rub and give a gentle massage on the eyelid and along the eyelashes. This gentle massage is also known to help express some styes. However, most doctors discourage patients from actively trying to pop and express a stye on their own, as pushing on a stye could in fact drive the infection deeper, leading toward a cellulitis, which is much worse. So again, most doctors discourage from actively trying to pop a stye. Now, if you've never heard of these eyelid cleaning products before, a lot of them do often contain tea tree oil in them. And that's because tea tree oil can help fight a nasty mite that likes to live in people's eyelashes called Demodex, which has also been strongly associated with the development of these eyelid styes, which we'll talk a little bit more about in a future video, so stay tuned for a video all about Demodex mites in your eyelashes. Okay, so what about beyond the at-home therapies? If you decide you do want to see a doctor about this, what sort of options may they be able to offer? Well, historically, doctors have had medications that they can prescribe. Namely, you'd think it's an infection of the eyelid, probably prescribe an antibiotic. Doctors usually have an eye drop or an eye ointment antibiotic that they can prescribe. There's also oral antibiotics. Those are often prescribed if it's a really large stye or it's just very deep in the eyelid. There's also a kind of side benefit of oral antibiotics is that some of them can also change the inflammation that occurs in the glands of the eyelid, which can also be beneficial for people who get recurrent styes or if there's somebody who has other problems with like dry eye disease, for example. The only downside to prescribing oral antibiotics is that sometimes they can upset the stomach as well as disrupt the gut microbiome. So that's something that your eye doctor has to think about and have a conversation with you about. Now, I will share that I used to frequently prescribe antibiotics to treat these types of infections. However, a 2022 study came out looking at the efficacy of using antibiotics, whether they be oral or topical antibiotics, to treat these types of hordeola, and they found that there was really no significant advantage of using these antibiotics versus just the at-home conservative therapies. So personally, since then, I've leaned a little bit more heavy on recommending conservative treatments than going with the medication. But of course, depending on the case, I think the use of an antibiotic can still have merit, especially considering there are publications for things like topical steroids helping improve the resolution or speeding up the resolution of signs and symptoms. But it's something that I personally like to have a conversation about with my patients so that they know all their options. Now, thankfully, most styes are considered self-limiting, meaning they usually get better even on their own with a matter of between 1 to 3 weeks. However, if a stye doesn't get better or keeps reoccurring, then there are some more advanced treatments. For tougher cases where the stye just doesn't resolve, there is a surgical procedure where they do incision and drainage of the stye. Sometimes they even do an injection of a steroid medication to calm down inflammation. Hopefully it never gets to that point, but it definitely is an option and something to consult with your eye surgeon about. All right, so when does somebody absolutely need to see an eye doctor for an eyelid stye? Well, honestly, anytime that something is changing on the eyes or the eyelid, I think it is best to have it evaluated by a local healthcare professional to get a proper diagnosis and be prescribed proper treatment. I think anytime there's redness, pain, or any changes to vision, then it's an absolute must. You want to talk to somebody. Although it's rare, there are cases where hordeolum or these eyelid styes have progressed to a pre-orbital cellulitis or a full-blown orbital cellulitis, and those can get pretty serious. Now, a common known cause of getting eyelid styes is in fact eyelid mites called Demodex that I mentioned before. If you want to learn more about what those Demodex mites are, how to stop them, and how to prevent them from becoming a problem, then check out my next video coming up over here. Thanks so much for watching. Keep an eye on it, and we'll see you in that next video.